Coronary artery bypass surgery in patients with ischemic cardiomyopathy. Ischemic cardiomyopathy is the most common type of coronary heart disease. Occurs when blood flow to the heart muscle is reduced by partial or complete blockage of the coronary arteries. Sudden and severe obstruction of a coronary artery can lead to a heart attack. Myocardial ischemia can also cause severe arrhythmias.
When the supply of oxygen is reduced then, myocardial hypoxia may ensue, particularly if compounded by situations that increase demand. This diagram looks at the issue in a bit more detail. As we know, the left ventricle of the heart pumps blood via the aorta to the rest of the body, and right at the beginning of that pathway, the aorta gives rise to the coronary arteries, so supplying blood to the myocardium. Now, imagine we were able to fix devices that monitored the stresses of the body, the oxygen demands of the myocardium, and the degree of blood flow reaching the myocardium through the coronary arteries. When the body is under increased stress then, classically due to exercise, the heart promptly reacts to this by increasing cardiac output, mainly through an increase in the heart rate. This process increases the myocardial oxygen demand, and to allow for this, there is a compensatory increase in the coronary blood flow to the myocardium, and this volume is known as the coronary flow reserve. Problems can arise when there is a restriction of blood flow through the coronary arteries. This is commonly due to atherosclerosis, in which deposits of fatty material known as plaque build up in the large and medium-sized coronary arteries, and so limit blood flow to the myocardium. When the restriction is sufficient to occlude the luminal diameter by more than 70%, stable angina, also known as exertional angina, arises. In other words, now when there is increased stress on the body, the myocardial oxygen demand cannot be supported through the coronary blood supply. The smaller arteries distal to the stenosis are maximally dilated, and the coronary flow reserve is near zero, and thus ischemia ensues. It is this ischemia that produces angina, which is termed stable as its production is dependent on the myocardial oxygen demand. This isn't the whole story of how ischemia can arise, however, as it can develop more acutely and severely. As a plaque becomes more advanced, the arterial wall thickens and hardens, whilst smooth muscle cells multiply and move to the surface of the plaque, contributing to the formation of a fibrous cap. Over time, this cap may erode and break open, releasing plaque into the bloodstream. The plaque can flow downstream and undergo thrombosis, completely ceasing the coronary blood flow through the artery due to total occlusion of the lumen. The acute event produces ischemia irrespective of whether the myocardial oxygen demand is otherwise low, and produces an acute coronary syndrome, which will be discussed in more detail shortly in this chapter. It is important to be aware that the distinction between these two processes is not so clear-cut as this in reality. Indeed, in some cases, ACS may arise simply due to a gradual worsening of the stenosis that normally gives rise to stable angina, though the ACS is less likely to be as acute as that occurring due to thrombosis.
The symptoms are angina pectoris, pain in the neck or jaw, difficulty breathing, dizziness, palpitations. Cause: coronary artery disease, blood clot, coronary artery spasms. Complication: heart attack, irregular heartbeat, heart failure. Treatment: medicine, aspirin, nitroglycerin, beta blockers, cholesterol reducer drugs, channel blockers, angiotensin converting enzyme inhibitors, and surgical procedures, colon angioplasty and stenting, coronary artery bypass surgery.
The tip of the catheter is then deployed, occluding blood flow with its silicone elastomer on the distal aspect of the funnel. This results in the mouth of the funnel tip being maximally expanded in a radial fashion by the patient's own blood pressure, creating a seal against the arterial wall and arresting blood flow. Cessation of blood flow prevents clot fragments from traveling downstream, greatly reducing the potential for distal embolization. The patient's blood pressure, along with the radial force of the funnel tip, combine to press the device against the arterial wall, anchoring the catheter firmly and safely. The outward expansion of the Megavac anchors and centers the device and can be used as an anchor for other devices in crossing tight lesions or tortuous vessels. Once the Megavac arrests blood flow, the thrombo wire is inserted through the catheter, advanced through the clot, and deployed distal to the clot. While applying suction with the Megavac, the thrombo wire is retracted to simultaneously pull the clot into the funnel mouth and through the catheter. After complete clot removal, suction is discontinued and the catheter tip is undeployed.
Bypass surgery is the most common type of heart surgery. Arteries can become clogged over time by the buildup of fatty plaque. Bypass surgery improves the blood flow to the heart with a new route or bypass around a section of colloid or diseased artery. The surgery involves using a section of blood vessels from the leg, chest, or another part of the body to grab into the affected coronary artery, thus bypassing the clogged or diseased section. During bypass surgery, the breastbone sternum is divided, the heart is stopped, and blood is sent through a heart-lung machine. Unlike other forms of heart surgery, the chambers of the heart are not opened during the operation. Some bypass procedures can be done as limited access surgery, described below as minimally invasive bypass.
Heart bypass surgery creates a new route called a bypass for blood and oxygen to reach the heart. Heart bypass surgery begins with an incision in the chest, and the breastbone is cut, exposing the heart. Next, a portion of the saphenous vein, which is very large, is harvested from the inside of the leg. Pieces of this large vein are used to bypass the blocked coronary arteries, which are arteries that supply blood to the heart. The venous graft is sewn to the aorta, the main artery of the body, and to the affected coronary artery to bypass the blocked site. The internal mammary artery from the chest may also be used to bypass a clogged artery. Several arteries may be bypassed depending on the condition of the heart. After the graft is
Pros. Surgery seems to be associated with reduction of mortality from any cause. There is improvement in the quality of life in a period of 3 years after coronary surgery in patients with severe chronic arterial disease. Coronary surgery in patients with left ventricular systolic dysfunction can be performed with a relatively low mortality, 1% at 30 days.
In a new study published in the New England Journal of Medicine, we looked at outcomes between bypass surgery and stenting for patients with multivessel coronary artery disease, multivessel blockages. And we found that with respect to long-term mortality, there was actually no difference between bypass surgery and stenting. Stent is a hollow mesh-like tube So the stenting procedure is done percutaneously, either through a puncture through the groin or through a artery in the wrist, and we pass a wire through the blockage and deliver the stent and put the stent through. So it's very minimally invasive, and patients usually go home either the same day or the next day. With bypass surgery, it's a surgical procedure, so there are many different ways of doing it. The common one is to do a median sternotomy and open the chest up and artery grafts, or take veins from your legs and use that to bypass the blockages. For patients and physicians, our study gives them up-to-date information as to which one to choose. I mean, is it bypass surgery or the latest generation stents? And we know that there are pros and cons with every approach, and I think knowing the pros and cons would help them make an informed decision.
Cons. Patients with ischemic ventricular dysfunction and pre-exercise capacity have a short-term risk and similar 5-year mortality with coronary surgery compared with medical therapy. Coronary surgery does not reduce episodes of sudden death. Serious postoperative complications occur approximately in 1 out of 4 patients and are associated with higher mortality. Zoo athlete in Ecuador. 63-year-old patient with type 2 diabetes mellitus of 20 years of evolution with significant microvascular involvement, with arterial hypertension and dyslipidemia, that consult for episodes of thoracic pain of effort of months of evolution, carrier of pacemaker and therefore with electrocardiogram not interpretable, coronary angiography showing the size, diffuse, and severe coronary strikes. In the clinical case, the control of the factors of risk in the diabetic patient, the diagnostic process in the patient with stable angina, the therapeutic adjustment, facing medical treatment at the decision of revascularization, and in this case, if obtained, for percutaneous intervention or coronary arteries bypass surgery.
Kind of a rating system. The reason I picked the XL Hospital, which isn't, what is it, GCI rated? The reason I picked the XL Hospital, I didn't really pick the XL Hospital. What I picked was Dr. Jose Hernandez. I read up on him and found out he started this hospital down here, and his credentials were impeccable. He's an American doctor. He just goes across the border and does his work over here, where of course it's not as expensive as our American hospitals. That's why I picked the XL Hospital. And it was pretty convenient too, it's just not even a mile across the borders.
Conclusion. In this case, it can be observed that the diabetes mellitus is a very common disease in Ecuador that is related to ischemic heart disease. Intensive treatment of the risk factors of the patients can advantageously decrease cardiovascular events. Once coronary heart disease is diagnosed, medical treatment seems to be the best option in patients with good control of symptoms, but in patients who persist symptomatically, revascularization surgery seems to have advantage over